Hi, myocardial infarction. Introduction. Actual bacterial and viral infections are associated with the uncertain rise of myocardial infarction. The insertion in the short-term risk is associated with influenza, pneumonia, acute bronchitis, and other respiratory infections. The association between acute infection and increased rise of myocardial infarction persists beyond the short post-infection period. Possible mechanisms are plaque containing inflammatory cells infected in another part of the body generates circulating inflammatory fluid.
Myocardial infarction, commonly referred to as heart attack, is the sudden death of part of the heart muscle due to loss of blood flow. This occurs when one of the coronary arteries, the arteries that supply blood to the heart, is blocked. The blockage is commonly due to atherosclerosis, cholesterol plaques or fat deposits on the wall of blood vessels. As the plaque builds up, the vessel becomes narrow, restricting blood flow. Under stress, the plaque may rupture. This triggers formation of blood clot on top of the plaque, leading to complete blockage of blood flow. When this happens in the coronary artery, the downstream patch of the myocardium dies from lack of oxygen. We can use to open narrowed or blocked coronary arteries. It can also be performed as an emergency treatment for myocardial infarction. The first part of the procedure is to localize the site of blockage. This part is called cardiac catheterization. A guiding catheter is inserted through the femoral artery at the groin and threaded all the way to the aorta. The tip of the catheter is placed at the beginning of the coronary artery to be investigated. A radio-opaque dye is injected through the catheter into the coronary artery. This enables real-time visualization of the artery using X-ray imaging. A guide wire with a deflated balloon is inserted and pushed to the location of blockage. The balloon is inflated to crush the plaque. At the end of the procedure, the balloon is again deflated and removed together with all catheters and guide wire. In some cases, a stent is inserted together with the balloon, inflated, and left in place of the plaque to keep the artery open permanently.
Definition. The heart is nourished by a series of arteries called coronary arteries that supply the heart muscle and allow it to exercise its function as a cardiac pump, contracting and relaxing. Acute myocardial infarction, along with pectoring, is part of what is currently known as acute coronary syndrome. Signos y síntomas. Areas of pain: upper abdomen, left arm, jaw, chest, or between the shoulder blades. Type of pain: like a tie feels the chest. Whole body: like stunning, fatigue, descent, cold, and weak skin. Gastrointestinal: heart, indigestion, nausea, or vomit. Discomfort of a person. Diagnostic: electrocardiogram, cardiac enzyme test, chest X-ray, skin.
myocardial infarction is acute closure of the coronary artery, which is related to either rupture of the plaque, leading to acute onset of thrombus formation and sudden arrest of blood supply to that area, which is defined as ST elevation myocardial infarction. You may not have chest pain in certain conditions. Majority of the time you will have chest pain, but there are certain variables like advanced age, diabetes, they may not have chest pain. Woman heart attack usually presents as an atypical symptoms, which may be a variable from the normal chest pain and can mimic different conditions. Like they can present with neck pain, epigastric pain, and different variants of the chest pain which are not typical of angina, of the life with aortic stenosis. So patients with mitral stenosis, they usually have underlying history of mitral stenosis, especially have underlying history of rheumatic heart disease. So more commonly seen, which has become less and less. And other conditions for mitral stenosis are very rare to happen. Mitral stenosis can be caused by, you have other patients with renal failure, patients who have left atrial myxoma, they can cause. These are the other conditions which are commonly seen, and degenerated mitral valve from advanced age that can also cause mitral stenosis.
Diagnostic. Treatment. The first mix and oxygen therapy. Anticoagulants, heart medication, narcotic, beta blocker, cytine, and ACE inhibitor. Surgery, coronary bypass. Medical procedure, coronary stent, and coronary angioplasty. Therapies, cardiac rehabilitation. Nursing intervention. Coordination between a level of health care involvement. Collaborating in the early treatment of the risk of IAMS. Take into account the potential side effects nausea, vomit, impotence, bradycardia, respiratory depression. Oxygen therapy, beta blocker orally, absolute diet, capillary glycemia, hemodynamic monitoring, pulse oximetry. Thank you.